Hello everyone. In June 2023, over 2,000 people in a small district fell ill within days, and we needed to find out why. We conducted an outbreak investigation linked to top water in the Niksar district of Tokat province. I will present the findings from our field study. On June 16th, an increase in cases presenting with nausea, vomiting, and diarrhea in the district was detected by our surveillance system. As the rise in cases continued, the outbreak was confirmed by the Tokat Provincial Health Directorate on June 21st, and we conducted field research between June 22nd and 25th. Niksar is a district in Tokat province located in the Black Sea region of northern Turkey, with a population of 33,000. The objectives of our investigation were to determine the cause of the outbreak, to identify the source and the causative agents, to implement prevention and control measures, and to prevent future outbreaks. We calculated attack rates, odds ratios within 95% confidence intervals, including all water source types. We conducted a case control study and carried out a face-to-face questionnaire by household visits. We interviewed the Provincial Health Directorate and clinicians to understand the scope of the outbreak. We reviewed hospital records to identify cases. We consulted the Provincial Meteorology Directorate about rainfall patterns and the Provincial Agriculture and Forestry Directorate to rule out foodborne source. Finally, we contacted the municipality to obtain information on water network renovations, repair works, and water audits. An outbreak panel was run on 7 stool samples at the microbiology reference laboratories. Microbiological and chemical analyses were performed on 26 tap water samples. Additionally, one virological sample was evaluated for norovirus and rotavirus. We measured residual chlorine in a total of 191 water samples. We defined non-compliant chlorine levels as those below 0.2 ppm. We learned that patients had nausea, vomiting, and abdominal pain and diarrhea, and some were hospitalized. Non-common food common food source was found among them. Heavy rainfall was recorded in the area before the outbreak, and no foodborne illness was reported in the district. Water network repair works were ongoing. Old pipes and reservoirs were being replaced, and water audits had occurred during this period. This slide shows the epidemic curve. The blue bars represent the number of cases over time, while the red line shows total rainfall. The faucet icons indicate water audits, and excavator icons mark the municipality's infrastructure repair works. Case numbers began increasing from 90th, peaked on 22nd, and then started to decline, consistent with a prolonged point source outbreak pattern. Notably, the period between June 12th and 20th was rainy, with infrastructure works and water audits occurring on June 17th, 19th, and 20th. Nausea, abdominal pain, and vomiting were the most frequently reported symptoms. Of patients with diarrhea, 90% had watery stools, and no bloody diarrhea was reported. Crude attack rate was 3.4%, with 4% in females and 2.8% in males. The attack rate was greater than 4% in 5 to 24 age group, reaching 5% in the 5 to 9 and 15 to 19 age groups. Cases were observed across all neighborhoods in the district. The neighborhoods shown in the darkest shade on the map had attack rates exceeding 5%. To test the hypothesis that contaminated tap water was the cause of the outbreak, we conducted a case control study. Suspected cases were who had visited the hospital from central neighborhoods and received a gastroenteritis related diagnosis code between June 18th and 23rd. Probable cases were defined as suspected case with at least one acute gastroenteritis symptom. Controls were each individually matched to their neighborhoods who had no symptoms. We identified 1,109 suspected cases. Using simple random sampling, we selected 462. Questionnaires were administered to 440 of them and their controls. Analyses were conducted on 432 cases and 432 controls. When bottled water is used as a reference, the odds of drinking tap water was 1.6 times higher. The district's tap water was supplied from 13 interconnected reservoirs. At the time of the outbreak, renovation works were ongoing. Two old reservoirs on the left side remained in use despite poor structural conditions, and free chlorine levels were insufficient at multiple monitoring points. The IVAS reservoir, the largest in the network on the right side, was located in close proximity to infrastructure works, and residual chlorine levels were non-compliant. We thought that heavy rainfall triggered the outbreak by causing contamination in these three reservoirs. We observed non-compliance in residual chlorine measurements. Microbiological analysis revealed contamination in 3 out of 26 samples, with E. coli and coliform bacteria detected. No agent was identified in the virological examination of water. In stool samples, norovirus G1 and 2 and E. coli species were detected by real-time PCR. Anthropathogenic E. coli was identified in one sample culture. The outbreak exhibits the characteristic of a prolonged point source outbreak triggered by infrastructure works, water audits, rainfall, and disruption in chlorination. Widespread distribution of cases across the district center. Along with epidemiological findings and laboratory results, we suggested that the outbreak may have been caused by sewage contaminated water. We advised on water usage, hygiene, and hand washing, and issued a do not drink advisory. Case numbers declined after shutting down the contaminated reservoir and maintaining continuous chlorination and tap water monitoring. Thank you for your attention.